In this session, we are looking at psychiatric emergence, and our concentration is on the November 2024 past paper question. So we'll go straight to the scenario. The scenario says, Mr. Kisonge, a non-schizophrenic patient, aged 35 years, admitted to a psychiatric facility with hallucinations, telling him to take away his life. Question A says, define the term psychiatric emergencies. B, outline 5 psychiatric emergencies. C, describe the nursing care of Mr. Kisonge taking into account the suicidal ideation. D, explain 5 roles of a nurse in suicide prevention. So in terms of defining psychiatric emergencies, you can say these are acute psychiatric problems that lead to a serious outcome such as self-harm or violence, characterized by suicide itself, violence, alcohol, or drug intoxication. The next question B, says, outline 5 psychiatric emergencies. Amongst the psychiatric emergencies that we can talk about, the first one is suicide itself, where someone causes death by injuring themselves and the intention is to die. So the patient may take harmful substances and they may present in unconscious state as well. Aggression is also a psychiatric emergence condition, and this is where someone has behavior that intends to cause harm or pain to others, either physical or verbal. And of course, we see that there is always verbal abuse and also lack of remorsefulness in such patients. Panic attack is also a psychiatric emergence because the patient has that overwhelming fear and anxiety in them, and they always feel like they're on the brink of death. And one of the common characteristics we see is shortness of breath, or feeling like choking, like they can't breathe. And that is why panic attacks are also psychiatric emergencies. Intoxication, be it alcohol or drug intoxication, this always impairs the patient's mental and physical abilities because of either excessive consumption of alcohol or drugs. Acute psychosis, we see individuals in acute psychosis that they go into psychotic symptoms like having delusions, hallucinations, disorganized thinking, or severe agitation. All these may easily cause harm unto others because there is always lack of reality in them. So these are some of the patients, these are some of the emergence psychiatric conditions. Question C says, describe the management of the patient paying into attention, especially that they are having suicidal ideations. Of course, from there you talk about the safe environment, nurse-patient relationship, talk about the suicide risk assessment, sleep, rest and sleep, talk about observations, psychotherapy and counseling, communication, nutrition, talk about hygiene, family therapy as well. So as usual, as you talk about the management, always talk about the aims as well. And these are the points that you can put on safe environment. These are the points that you talk about on nurse-patient relationship. On rest and sleep, these are the points or interventions that you talk about. Talk about observations, and mental state examination does not have to miss. Talk about the suicide risk assessment, talk about cognitive therapy, talk about psychotherapy and counseling. From there, talk about hygiene, of course, talk about nutrition, medication as well, talk about family therapy, and also you can still add behavioral therapy as well. So that is the outline you can use. And in cases where you are asked to nurse the patient with a psychiatric emergence, like the way the scenario is, using a nursing care plan, you can still set the first problem, you can still set disturbed thought process related to feeling of hopelessness and despair, evidenced by likelihood of self-harm. Another problem you can talk about is self-harm related to increased suicidal thoughts evidenced by patients' attempts to commit suicide. You can talk about social isolation related to feelings of worthlessness and shame, evidenced by withdrawal from family and friends. You can still talk about disturbed perception related to low self-esteem due to negative self-perception, evidenced by patients' perceived lack of future. So those are some of the problems that you can use for this particular scenario in cases where you are asked for a nursing care plan. Now, the last question said the roles of the nurse in suicide prevention. Amongst the roles of a nurse in suicide prevention, the first one is early identification of risk factors. The nurse can play this role by assessing patients for warning signs and risk factors. They look at different patients and how they are presenting, because patients may show signs of suicide when we pay close attention to them. Apart from that, the other role of a nurse is conducting a suicide risk assessment. The nurse can focus on this particular area, screen the patient, communicate to the patient, assess the suicidal thoughts, plans, means, and intent in as they interact with patients, of course. Providing emotional support and building rapport. The nurse can use this particular role by being non-judgmental, having empathy, trust, and also helping the patient to feel safe so that the patient can open up. The patient and the nurse rather can also use the role of developing a safety plan for patients who are at high risk of committing suicide. The nurse rather can collaborate with the patient to create a personalized safety plan, a plan that should not allow the patient to easily kill themselves until a solution is found, by helping the patient understand the problem and helping them go through that particular problem. The nurse can use a collaborative role. The nurse can make sure that the patient is referred to different mental health professionals. The social workers can be involved, community resources can be involved, just to help the patient be treated effectively. The nurse can also use the advocacy role. The nurse rather can help educate the patients and the families on the mental health coping strategies and how they can recognize warning signs. At the same time, help the advocate for them for better mental health services and policies, so that even patients who are mentally ill can still access good services. So that is how we can attempt this particular question that was in the November 2024 paper.